We are back with an update on state health plan for state employees, teachers, retirees. A lot of people are waiting to see what's going to happen on Friday when the State Health Plan Board is slated to take a vote. There have been some pretty big occurrences, though, since we did the last video. And Chuck, could you get us up to date?
Absolutely, Ardis. The good news is that the enhanced PPO 8020 is going to remain a plan option, at least for calendar year 2017, and probably, though we don't know for sure, for at least 1 year beyond that. There's still discussion of whether that plan will continue to exist in the future. So that's the good news that came out of today's meeting.
So the 80-20 would be okay for now, but potentially in jeopardy down the line.
That is correct. And again, this assumes that the State Health Plan Board of Trustees on Friday agrees with the revised recommendations that the State Health Plan staff present to them.
We've heard that a lot of people have watched your previous video, and SEANC members have been telling us, and teachers have been telling us that they've seen the information about this. They've been very upset, and they've contacted both the legislature and the Board of Trustees of the health plan. So do you think that made a difference?
Ardis, I just want to give a huge shout out to everyone first who took time to watch the video, because doing videos is not my favorite hobby. But secondly, having taken that time to look at the video, then turned around and contacted their legislators, because the absolute only reason anything is changing today is because of the phone calls those members made, and because of the letters they wrote to the editors of their newspapers and the media contacts that they made. So they get the credit for turning this thing around.
Because it's unfortunately not over. You gave us the good news, which is the 80-20 isn't on the chopping block anymore as of Friday. But we really don't know what's coming on Friday to be voted on. What is the bad news?
We saw some proposals today that are still going to make benefit changes to the 70-30 and to the current benefit design and the enhanced PPO 80-20. And basically those changes are designed to make those plans less valuable, and to, in a very subtle manner, shove members into the consumer-directed health plan. And our members have indicated, and I haven't heard any different from any state health plan member, they want options. And again, if you keep making the benefits in the 80-20 and the 70-30 lower, then you're basically forcing many people to take the consumer-directed health plan.
So is there just not enough money?
In 2010, there was a legislative study commission on the state health plan. That study commission found that North Carolina contributes less per member than virtually any other state. And I'm not talking about, compared to California, compared to New York, compared to Massachusetts. I'm talking about compared to the southeastern United States, Georgia, Tennessee, right. Virginia.
We're bringing up the rear in healthcare. There's no question.
And so we are at the bottom of the totem pole. There is not adequate funding of the state health plan, not when you look at the number of people that we insure.
So we know there's $1 billion in the reserves of the health plan. $1 billion with a B. But the health plan indicated today, again, really more clearly than ever before, that it is their feeling the General Assembly is to blame for whatever changes we see on Friday.
The state health plan is basically still putting this back on the General Assembly, saying that, we've still got to make these changes for 2017. The question was raised, well, why not, talk some more with the General Assembly about either allowing them to spend below that 20% reserve level, so that these benefit changes would not be needed. And the basic indication was that wasn't going to occur.
this is going to be done. Something's going to be done. It will, like you said, be blamed on the General Assembly. And yet the General Assembly isn't here to weigh in to say whether that's what they intended at all. So the health plan is basically shooting at a target that's one of many targets, and they're hoping it's the right one.
Absolutely correct, Ardis. And what they could do, they could take an initial proposal, and then say, but if the General Assembly allows us to either spend down the reserves instead of 20%, maybe to 15% or some other level, we would not have to implement these changes. We get back to the one big thing that can save the state health plan more than $250 million per year. And that was brought up today about linkage to Medicare rates. Our proposal has been pay more than Medicare rates so that you want to ensure access to hospitals and healthcare providers. So you've got to see that there is some margin that they can remain in business. At the same time, it is absolutely abhorrent and it's wrong that plan members are being asked to pay more and more out of pocket when they're not being given increases. Plan members are paying too much, and the taxpayers are paying too much.
And SEANC has, we talked about Charles Johnson last time, a past president who's on the board of trustees, and he's been getting a lot of emails. I guess we'll put his email address on the screen of this video. He's going to look at every one of them and bring them to the health plan board of trustees meeting. And so we would encourage people to continue to email, at a minimum, him. And that's, I think, where we're at with member engagement and what people can do. Okay, if you're a SEANC member, please contact the board of trustees. And also, SEANC will be sending information out to you as we get it about board of trustee email addresses and anything else. Please look at that. Please forward it to people who aren't SEANC members so that they can know. And let's fight the rest of this fight together.